According to the WHO, dementia is the seventh leading cause of death and a major cause of disability and dependency among older adults worldwide. You might think, I'm too young to worry. But changes in the brain can start years or even decades before the first symptoms appear. That's why it's crucial to pay attention. In this video, we'll discuss 16 signs of dementia that most people ignore until it's too late and how you can prevent it. Dementia is a term for a decline in cognitive function affecting memory, thinking, language, and judgment. There are different causes of dementia such as vascular dementia, which usually comes after a stroke, Lewy body dementia, and Alzheimer's disease. Alzheimer's is the most common, accounting for 60 to 70% of cases. Now, let's explore the early signs of dementia. Sign number 1. Short-term memory loss. Difficulty in remembering things is one of the most well-known early signs of dementia. Studies show that the hippocampus, the part of the brain responsible for forming memories, is often one of the first areas affected by Alzheimer's disease, a common cause of dementia. When this region is impacted, a person might struggle to recall recent conversations or events. For example, they may forget what they had for breakfast or miss a recent appointment. If you or someone you know is experiencing memory loss in these ways, dementia could be the cause. Sign number 2. Difficulty in doing familiar tasks. The parietal lobe of the brain, which helps integrate sensory information and coordinate movements, is often affected in the early stages of dementia. Damage to this area can make it hard to perform complex tasks that require planning and sequencing, such as bathing or getting dressed. For instance, a person with dementia might forget how to turn on the shower or the correct order of washing different body parts. They may also struggle with the sequence of putting on clothes, like forgetting to put on socks before shoes or accidentally wearing clothes inside out. Everyday tasks like cooking, cleaning, or using household appliances can become confusing and overwhelming. Sign number 3. Difficulty in communication. People with dementia often struggle to find the right words during conversations. They might use incorrect words or vague terms like thing or it. Keeping up with conversations, especially in noisy environments or group settings, can also be challenging. This happens because the left hemisphere of the temporal lobe, which is vital for language processing, is often affected by causes of dementia like Alzheimer's disease. As a result, people with dementia may have trouble understanding what others are saying, leading to confusion and miscommunication. This sign can be hard to notice, and even when noticed, it's often mistaken for being absent-minded. So, it's important to pay close attention to this sign. Sign number 4. Misplacing things. Have you been forgetting where you placed your keys or glasses? The hippocampus, which is crucial for forming new memories, is often affected by dementia. This makes it harder for the brain to remember where things were placed. While this might seem like simple forgetfulness, it can also be an early sign of dementia. Objects may end up in unusual places like a remote control in the fridge or keys in the bathroom. Sometimes the person might accuse others of stealing or hiding their belongings because they can't recall where they left them. This can lead to frustration, and misplacing important items like medication or keys can be a safety risk. If you notice this sign, it's a good idea to consult a doctor. Sign number 5. Confusion about time and place. Did you know that losing track of time can be a sign of dementia? People with dementia may become disoriented about the time of day, the date, or even the year. For example, they might wake up in the middle of the night thinking it's morning. They may also miss appointments or important events because they struggle to keep track of time. In Alzheimer's disease and other forms of dementia, the parietal lobe and hippocampus, areas critical for spatial orientation and memory, are often affected. When these parts of the brain begin to degenerate, it can lead to confusion about time and place. Sign number 6. Changes in mood, personality, and behavior. Sudden mood swings, such as becoming sad, angry, or anxious without an obvious reason, can be early signs of dementia. The frontal lobe of the brain, which controls personality, behavior, and emotions, is often affected in the early stages of dementia. This can cause a person to become withdrawn, suspicious, or fearful. Someone who was once outgoing may become more introverted. Changes in behavior are also common, such as becoming agitated, aggressive, or even displaying inappropriate behaviors like making rude comments or acting impulsively. If you notice someone acting very differently from how they used to, it could be a sign that they are in the early stages of dementia. Sign number 7. Apathy or lack of interest and motivation. A person with dementia might stop participating in social events, hobbies, or activities they once enjoyed. Apathy is often linked to changes in the frontal lobe of the brain caused by dementia. This part of the brain controls motivation, planning, and social behavior, so damage to it can lead to withdrawal from social activities. They may also lose interest in everyday tasks like cleaning, cooking, or maintaining personal hygiene. These signs can easily be mistaken for tiredness or even depression, so it's important to consult a doctor if you notice them. Sign number 8. Postural changes. Did you know that changes in posture and difficulty moving around might not just be signs of old age? Dementia can affect areas of the brain like the basal ganglia and cerebellum, which are involved in movement and coordination. Because of this, people with dementia may develop postural changes early on. For example, they might have a stooped or hunched posture, which can affect their balance and mobility. They may also begin to walk with a shuffling gait, taking smaller steps and struggling to lift their feet. Poor balance and coordination can increase the risk of falls, which can be dangerous. So, if someone you know has been falling a lot, it may not just be clumsiness, they could have dementia. Sign number 9. Challenges in understanding visual and spatial information. Did you know that dementia can affect the occipital lobe, the part of the brain that helps us see and understand where things are? This means a person may struggle to judge distances accurately, making tasks like driving, navigating stairs, or recognizing familiar faces challenging. They might also have trouble following directions or get lost in familiar places. Reading can also become challenging due to difficulties in processing visual information. If someone is experiencing these issues, it might be an early sign of dementia. Sign number 10. Difficulty in making decisions. If someone is having trouble making even simple decisions like what to eat or what to wear, it might be due to changes in the frontal lobe of the brain caused by dementia. They may also make poor or unusual decisions that don't align with their usual behavior or are inappropriate. For example, a person with dementia might give away a large amount of money they can't afford to lose, or they might neglect personal hygiene. If you or someone you know is making strange or poor decisions, it's important to consult a doctor. Sign number 11. Problems with abstract thinking. In Alzheimer's disease, the frontal and parietal lobes of the brain are affected early on. These areas are crucial for abstract thinking and problem solving. As a result, someone in the early stages of dementia may struggle with tasks that involve numbers, such as managing finances, balancing a checkbook, or calculating a tip. They might also have difficulty understanding complex concepts or following multi-step instructions. Tasks that require abstract thinking, like planning a trip or organizing an event, can become especially challenging. If you find these tasks difficult, it might not just be due to distraction or fatigue, it could be an early sign of dementia. Sign number 12. Repetition. Repetition in dementia is closely related to short-term memory loss. The hippocampus, which is crucial for forming new memories, is often one of the first areas affected by dementia. Damage to this part of the brain makes it difficult to retain recent information, leading to repetitive behaviors. A person with dementia might ask the same question repeatedly within a short time because they can't remember asking it before. They might also engage in repetitive actions, such as checking if the door is locked multiple times or verifying if they have their wallet. This repetition can extend to performing the same daily tasks repeatedly, like washing hands or cleaning. If you notice someone doing these things repeatedly, it might not be because they have OCD. They might simply not remember they've already done them. Sign number 13. Experiencing hallucinations and delusions. Did you know that hallucinations can be an early sign of dementia? People with dementia might see, hear, or feel things that aren't there. For example, they may see people or animals that don't exist. They might also have delusions, such as believing someone is stealing from them or intending to harm them when that isn't true. Increased paranoia and mistrust can lead to accusations and fear. This sign can be particularly challenging for those around the person with dementia because they might find themselves being accused of things they're not doing, which could also lead to strained relationships. If someone close to you suddenly started acting this way, be patient with them and consult a doctor. Sign number 14. Loss of bowel and bladder control. Did you know that bowel and bladder control is managed by the frontal and parietal lobes of the brain? These areas are often affected by dementia, making it difficult for the brain to send and receive signals that regulate bowel and bladder movements. As a result, a person with dementia may experience an increased and often sudden need to use the bathroom, sometimes with little or no warning. They might have frequent urges to urinate or difficulty controlling bowel movements, which can lead to unexpected accidents. This sign of early dementia is usually very embarrassing for the individual and can also lead to anxiety. Sign number 15, sleep problems. Our bodies have something called a circadian rhythm, which regulates our sleep-wake cycle. When this rhythm is impaired, it can lead to irregular sleep patterns. Studies have shown that people with dementia often experience problems with their circadian rhythm, resulting in shifts in their sleep-wake cycle. This means they might feel sleepy during the day and stay awake at night. Even if they do sleep at night, they may wake up multiple times and struggle to fall back asleep. Sign number 16, trouble recognizing family and friends. The fusiform gyrus, located in the temporal lobe, is one of the brain areas affected by dementia. This part of the brain is crucial for facial recognition. Damage to it makes it difficult for dementia patients to recognize people. They may struggle to identify familiar faces, even those of close family members and friends. They might forget names or confuse one person with another. In some cases, they might think a stranger is someone they know, or believe a family member is a stranger. While this sign can sometimes be mistaken for normal aging, it's important to consult a doctor if you notice difficulties in recognizing people. Now that you know the early signs of dementia to watch out for, let's talk about how you can reduce your risk. While there's currently no cure for dementia, leading a healthy lifestyle can help lower your risk factors. 1. Ensuring cognitive reserve by staying mentally active. Wondering what cognitive reserve is? It's simply the brain's ability to adapt and find new ways to complete tasks. Building cognitive reserves can help prevent dementia. In a study of over 1,600 older adults, researchers found that those who kept their minds engaged were 40% less likely to show symptoms of Alzheimer's disease. So, how can you build your cognitive reserve? Try learning a new language. Studies show that being bilingual can delay the onset of dementia by up to 4 years. You can also read books and newspapers, journal, or pick up new hobbies like painting, gardening, or cooking. Keeping your brain active is the key. 2. Manage blood sugar. Did you know that people with diabetes are at a higher risk of developing dementia? Recent studies show that diabetes can reduce cognitive abilities and increase the risk of dementia. High blood sugar levels can damage blood vessels, leading to a type of dementia called vascular dementia. So, managing your blood sugar is crucial for dementia prevention. You can do this by eating a healthy diet, exercising regularly, and also drinking plenty of water to help your kidneys flush out excess sugar. 3. Control blood pressure and cholesterol. Controlling your blood pressure and cholesterol is essential in preventing dementia. High blood pressure and cholesterol can cause inflammation, which is linked to Alzheimer's disease and other forms of dementia. Research shows that lowering systolic blood pressure by an average of 22 points can reduce the risk of dementia by 15%. Long-term studies also indicate that people with high blood pressure in midlife are more likely to develop dementia later in life. You can manage your blood pressure and cholesterol by eating a balanced diet and staying physically active. 4. Stay socially active. People with strong social connections are less likely to experience cognitive decline. Social interactions can stimulate the brain and help maintain cognitive functions. A study found that older adults with larger social networks had a 26% lower risk of developing dementia compared to those with smaller networks. So, if you want to prevent dementia, join clubs or classes, stay connected with family and friends, and attend social events. 5. Improve your diet and vitamin intake. Following a healthy diet, like the Mediterranean diet, can lower the risk of cognitive decline and dementia. This diet focuses on fruits, vegetables, whole grains, healthy fats, fish, and moderate dairy and poultry, while limiting red meat and sweets. Other diets, such as the ketogenic diet, a high-fat, low-carbohydrate diet, also have benefits, including reducing the risk of diabetes, which is linked to dementia. Vitamins like B12, C, D, and E are essential for brain and nerve function. You can get these vitamins from sources such as meat, sun exposure, berries, and other nutrient-rich foods. 6. Prevent head and brain injuries. Preventing head or brain injuries is another effective way to reduce the risk of dementia. Always wear appropriate protective gear such as helmets when engaging in activities like riding bicycles or motorcycles. Drive safely and adhere to traffic rules to minimize the risk of car accidents. If you experience a head injury, even if it seems minor, see a doctor immediately to assess and treat any potential damage. 7. Drink less alcohol and quit smoking. Did you know that excessive alcohol consumption can lead to brain damage? Alcohol can also interfere with the absorption of essential vitamins, such as vitamin B1, which is vital for brain function. Reducing alcohol intake helps preserve cognitive abilities and lowers the risk of dementia. Similarly, smoking decreases blood flow to the brain, increases oxidative stress, and causes inflammation, all of which can damage brain cells. If you have a habit of drinking or smoking, consider cutting back or quitting to reduce your risk of developing dementia later in life. 8. Reduce excess weight. Research shows that obesity between the ages of 35-65 can increase the risk of dementia by about 30%. That's why it's important to stay physically active, maintain a healthy weight, and avoid obesity, especially as you age. Engage in activities like walking, swimming, yoga, or any other exercise you enjoy. Also, focus on eating a balanced diet and check your weight regularly to ensure you're staying within a healthy range. 9. Maintain healthy sleep patterns. Did you know that insomnia and poor sleep quality can increase the risk of dementia? Sleep disorders like sleep apnea are also linked to higher dementia risk. For optimal cognitive health, aim for 7 to 8 hours of sleep per night. Maintaining a consistent sleep schedule and managing stress levels can help you achieve better sleep and reduce your risk of dementia. 10. Protect your hearing and treat hearing problems. Protecting your hearing and addressing hearing problems can help prevent dementia. Avoid loud noises, keep headphone volumes at a safe level, and take breaks from noisy environments. Untreated hearing loss can increase the risk of dementia by up to 50%, so it's important to get an annual hearing test, especially if you're over 50 or work in a noisy setting. Additionally, manage earwax buildup and treat ear infections promptly to prevent long-term damage. Are you struggling with fatty liver and unsure how to reverse it naturally? Check out our next video to discover effective solutions.